Father Mullah Charitable Institutions, Mangalore, rendering healthcare services for the last 140 years in this coastal Karnataka and also outside Karnataka state. The Nursing College, in collaboration with Father Mullah Simulation and Skill Center, prepared this video on first aid. First aid is very important. Whenever a person is ill or having certain injury, immediate medical care that is given to sustain life or till further higher end of treatment when required, immediate attention to save life is very important. And therefore, this video will certainly give guidance to our young students. Whenever such situation occurs, they are prepared and trained and using their skills to render first aid service to the person having injury or illness. Thank you.
Hello everyone, this is Devina, Vice Principal of Father Mullah College of Nursing, wishing you all a happy learning. First aid is a measure to deal with any accidents or injuries. If you consider accident as an action, then surely first aid should be the reaction. This reaction need to be effective, prompt and affordable until a trained personnel reaches the spot to give care to the casualty, or until the casualty could shift to any of the healthcare settings. Today, safe health at home and workplace is highly appreciable. Today we have legislations right from construction to maintenance of work and home environment with the aim to prevent accidents. The curriculum also gives lot of importance for the students and the teachers to have deeper understanding regarding first aid and its management. Keeping these views in mind, the Infant Jesus Central School Trivandrum had approached Father Mullah College of Nursing with the view to prepare a video on first aid. Their request was highly appreciated by the management of Father Mullah Charitable Institution. As a result, today we are here with this video. This video has been prepared by Medical Surgical Department of Father Mullah College of Nursing along with Simulation Center. I congratulate the efforts done by HOD Professor Victoria D. Almeida as well as Dr. Lulu Sharif. I also congratulate the staff and students of Father Mullah College of Nursing. With these words, audience, I present before you the most wanted video on first aid. More power to you, dear audience, in terms of knowledge and skill. Good luck.
Hi everyone, I am Victoria D. Almeida, Professor and HOD of Medical Surgical Nursing Department, Father Mullah College of Nursing. First aid is the first and immediate help given to a victim who is suffering from minor or major illness before the medical assistance is available, and the purpose is being to preserve life, to promote recovery and also to prevent further harm. And for this, to achieve these objectives, the first aider must be very much quick. He must be courageous and also be able to work in the team with good communication skills. In this context, the staff of Medical Surgical Department of Father Mullah College of Nursing have developed a video to educate the students of Infant Jesus School, Thiruvananthapuram. Hence, I congratulate all the staff of our department, and also I thank the management of Father Mullah Charitable Institutions. I hope this video will be helpful to the general public too. I wish you all the best, wish you all good luck.
A very warm good morning to everyone. I, Sister Nida SIC, the Principal of Infant Jesus Senior Secondary CBSE School, privileged to welcome Father Mullah College of Nursing and Stimulation Center to conduct an awareness program on first aid. I am very happy to know that Father Muller College of Nursing and Stimulation Center has well equipped with the most advanced medical stimulators and skilled trainers. Today, we are lucky enough to get an opportunity to listen the awareness program on first aid. On this occasion, I would like to remember the words of Peter Marshall, a well-known pastor, as he said, "Small deeds done are better than the great deeds planned." A prompt and quick action can save the life of a person. Without any doubt, we can say that knowledge of first aid promotes the sense of safety and well-being amongst people. Although first aid is a temporary treatment, it plays a great role in preventing the stimulation from getting serious or worse. I think this awareness program on first aid will enable the staff and students of our school to assist an injured person till the medical assistance arrives. I congratulate the management and the faculty of Father Muller Charitable Institutions for their strenuous effort to make this video. Father Muller Charitable Institutions are always being one step ahead of the time to configure the excellence. The wisdom shares from this temple of education enlighten the mind and heart to lighten the healthcare portions to save many lives. May the knowledge acquired from this video be a window to promote and preserve many lives.
First aid. First aid is a temporary and immediate assistance given to any person who is injured or suddenly becomes ill using facilities or materials available at that time prior to professional medical help. Aim: to preserve life, to prevent further injury and deterioration of the condition, to make the victim as comfortable as possible to conserve strength, to hand over the injured person to professional medical caregivers at the earliest. Golden rules of first aid. Act quickly without panic. This is the golden hour. Reassure the victim and the relatives sympathetically. Avoid handling the victim unnecessarily. And arrange for the safe removal of the victim to a medical facility as soon as possible. Check for the following: the failure of breathing, the failure of blood flow, presence of bleeding, and control if any major bleeding occurs. First responder skills. Make sure that the scene is safe. Gain access to the patient. Gather information from patient and the bystanders and determine the vital signs. Determine signs that require emergency care and perform the necessary ABCs of emergency care that are airway, breathing, circulation, and bleeding control. Perform the proper transfer techniques. The first aid kit. A first aid kit is a collection of supplies and equipment that is used to give medical treatment. You can buy a first aid kit at medical stores or a local Red Cross office, or make your own. If you make one at a home or school, a plastic box with a flap lid or containers for storing art supplies are ideal. Emergency numbers. The following emergency contact numbers place in the first aid box. Police station 100, fire station 101, ambulance 108, women helpline 1091 or 181, child helpline 1098, flood or disaster helpline 1070 or 1077. The minimum required items in the first aid box are a gauze roll and pads, bandages, adhesive tape, gloves, first aid manual, the emergency contact information or medical information for family members, a pair of tweezers, scissors, triangular bandage, emergency blanket, antiseptic wipes, elastic bandages, safety pins, thermometer, and an instant cold pack. Keep your first aid kit in an area, a central location so it is easily accessible. Try to keep the first aid kit at a room temperature. If your first aid kit contains medications, remember to check the expiry date and replace when necessary. Remember to keep the first aid kit away from small children and consider keeping a first aid kit in a school bus. Fainting. Fainting is a sudden loss of unconsciousness, usually temporary, and typically caused by a lack of oxygen in the brain. The symptoms of fainting are lightheadedness, blurred vision, sweating, confusion, nausea, and vomiting. If you see somebody fainting, make sure that the scene is safe. Call for help. Check for breathing, coughing, or movement. If you cannot detect any, start CPR. Place the patient on his or her back. Loosen all belts, ties, collars, and any restrictive clothing. Make sure the area is well ventilated and ask other people to move away. And if it is inside, open the windows. If the individual is breathing, raise his or her legs about 12 inches above the heart level to restore blood flow to the brain, either by pillows or placing their ankles on your shoulder. If they remain unconscious for more than a minute, put the patient in a recovery position and get emergency medical help. This is the recovery position. Keep the airway clear. Hand supports the head. The knee stops the body from rolling onto the stomach. Stay with the patient. If you must leave them alone at any point or if they are unconscious, put them in this recovery position to keep the airway clear and prevent choking. What should you avoid? Avoid pouring of water over the head of the fainted person. Avoid putting the victim's head on a pillow. This may obstruct breathing. Avoid giving food or drink to a fainted person until they regain consciousness. If you feel faint, lie down with your legs raised. If you cannot do this, then sit with your head lowered between your knees. Drink some water or juice. Take some deep breaths. Foreign body in the eye, ear, and nose. Foreign body in the ear. Never try to get lodged objects out of the ear, and always refer the person to a healthcare facility for further treatment. In case of an insect, fill the ear with clean salt water so the insect can float out. If it does not come out, refer the person to a healthcare facility for further management. Foreign body in the nose. Do not put anything into the nose. Make the victim breathe out through the mouth. Transport the victim to a healthcare facility for further treatment. Foreign body in the eye. Ask the victim to sit. Pull the lower eyelid down to inspect. Rinse the eye immediately with plenty of water for 10 to 15 minutes to remove the irritant out of the eye. Call 108 if foreign body cannot be removed or the person complains of extreme pain. Keep the eyes closed. If something is sticking in to the eyeball or pupil, do not try to remove it. Cover the eye and transport the victim to the nearest healthcare facility for further care. Chemical eye injuries. Rinse eye with the water for 15 minutes. Use an eye wash station or kit, tap water, saline or contact lens solution. Call 108. Nose bleeding. Make sure the scene is safe. Wear gloves and have the person sit and lean forward. Pinch the soft part of the nose on both sides with a clean dressing. Place constant pressure on the nostrils for a few minutes until the bleeding stops. If the bleeding continues, apply a cold compress for a few minutes to reduce the bleeding. Call 108 if you cannot stop the bleeding in about 15 minutes. If the bleeding is heavy, such as gushing blood, the injured person has trouble in breathing. A person with a nosebleed should lean forwards and should not be backward, otherwise the blood drains down the person's throat. Swallowed blood can lead to vomiting. Image is one of pinching the nose. The next method adopted can be placing ice cubes along with a cloth. A child can sit on an adult lap. The child tilts his head forwards and squeezes firmly above the nostrils. Burns. Minor burn, extensive burn, chemical burn, and electrical burn are the various types of burn injuries. Minor burns. Make sure that the scene is safe. Wear gloves. Remove the constrictive things like rings, watches, or constrictive clothing from the injured area before it starts to swell. Cool the burn area with cold water for at least 10 minutes or run cold water until it does not hurt. Cover with a dry, non-stick, sterile or a clean dressing. Elevate the affected parts to relieve swelling and pain. In the case of extensive burns, make sure the scene is safe. Wear a PPE and call 108. If the person or his clothing is on fire, put the fire out. Have the person stop, drop, and roll. Cover the person with a wet blanket and then remove when the fire is out. Jewelry and clothing. Cool the burn area with cold water for at least 10 minutes. Cover with a dry, non-stick, sterile or clean dressing. Cover the person with a dry blanket or a clean sheet or towel. Check for the signs of shock. Transfer the victim to a healthcare facility. Keep the patient quiet and reassure him. Chemical burn. Wash off the chemical in running water. Cut out contaminated clothing or anything of constricting nature like rings, bangles, belt, and boots. Do not apply any ointments or lotion. Keep the patient warm, but do not overheat. Keep burnt hands, legs, or foot elevated. If the victim's face is burnt, sit or prop him up and keep him under continuous observation for breathing difficulty. Do not immerse the extensively burnt area or apply ice water over it because cold may intensify the shock reaction. Do not open the blisters on the victim's skin. Shift him to the hospital on a stretcher. Electrical burn. Do not touch the person if he or she is still in contact with electricity. Turn off the power. Once the power is off, you may then touch the person. Make sure the scene is safe. Provide CPR if needed. Get the first aid kit and AED. Wear gloves, call 108 and shift him or her to a healthcare facility as early as possible. Wounds and bleeding. A wound. Wound is an injury to a body, as from violence, an accident, or surgery, that typically involves laceration or breaking of skin and usually damage to underlying tissues. Types of bleeding. External bleeding. Outside the body when blood moves from blood vessels through a break in the skin. Internal bleeding. Inside the body when blood leaks from the blood vessels or organs. External bleeding. Make sure the scene is safe. Send someone to get the first aid kit. Wear gloves and if possible have the person apply direct pressure to the wound while you wear gloves. Wash the wound with clean water. Apply dressing from the first aid kit and put direct pressure on the dressing over the bleeding area. Use the flat part of your fingers or the palm of your hands. If bleeding doesn't stop, you need to add a second dressing and press harder. Do not remove a dressing once it is in the place, because this could cause the wound to bleed more. Keep pressure on the wound until it stops bleeding. Once the bleeding has stopped, or if you can't keep pressure on the wound, wrap a bandage firmly over the dressing to hold them in place. Minor cuts. Wash the area with soap and water. Then apply a dressing to the wound. splinting. Make sure the scene is safe. A magazine, a piece of wood, cardboard, a piece of cloth can be used as a splint. A splint limits in the injury. A splint should be longer than the injured area and should support above and below the injury. After covering the area with a clean cloth, tie the splint so that it supports the injured area. You can use a gauze or a cloth to tie the splint. The actions to make and apply a tourniquet. Call emergency and get a first aid kit and an AED. Wear gloves. Fold the cloth or bandage so that it is long and at least 2.5 centimeters wide. It should be applied to the limb between the bleeding site and tightened so bleeding can be controlled by applying direct pressure over the wound. To make a tourniquet, use bandages 5 to 10 centimeters or 2 to 4 inches wide and wrap them around the limb several times. Tie a knot, leaving loose ends long enough to tie another knot. A stick should be placed between the knots. Twist the stick until the bandage is tight, enough to stop the bleeding, and then secure it in place. Choking. What is choking? Choking occurs when food or small objects block the airway. This prevents oxygen from getting into the lungs and the brain. Infant choking signs. You might suspect an infant is choking if he cannot cry and cannot make sounds, makes only a high-pitched squeaky sound and has bluish lips or skin. Choking infant. Call for help. Take over the child. Hold the infant face down on your forearm. Support the infant's head and jaw with your arm and give up to 5 slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant onto his back, supporting the head. Give up to 5 chest thrusts using 2 fingers of your other hand to push onto the chest. Repeat giving 5 slaps or 5 chest thrusts until the infant can breathe, cough or cry, or until he becomes responsive. If unresponsive, take him to the healthcare facility. Adult choking signs. An adult is choking if he cannot speak, cannot cough loudly, or makes the choking sign, that is holding the neck with one or both hands, and has bluish lips or skin. Ask the person, "Are you choking? Can I help you?" If the person speaks, ask him to cough loudly and call your doctor for further advice. If the person nods yes, tell him you can help him. Stand firmly or kneel behind the person, depending on the size of the person choking. Wrap your arms around the patient's waist so that your fist is not in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp the fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe or speak, or until he becomes responsive. If unresponsive, take him to a healthcare facility. Abdominal thrusts. Remember, if you cannot get your arms around the person's waist, do abdominal thrusts. Wrap your arms around the person's chest and give chest thrusts using the same first technique. Place your fist in the center of the chest, the same positioning you use for chest compressions, and pull straight back. Encourage anyone who has choked to consult a healthcare provider after the incident. Spinal injuries. Signs of spinal injury after an accident may include pressure in the head, neck, or back, intense back pain, paralysis or lack of coordination, or weakness in any part of the body, the loss of sensation or numbness or tingling in the hands, feet, fingers, or toes, twisted or oddly positioned neck or back, impaired breathing, a loss of control of bladder or bowel, trouble in walking and balancing. Care and treatment. Airway, breathing and circulation should be maintained. Call 108. Initial examination should be done. Carefully remove the helmet if present. Apply a cervical collar if trained to do so. The movement, that is log roll, should be performed and utilize assistance for the same. Maintain the victim's head in line with the shoulders and the spine. This is the video of log roll. Transport of a patient with injury. You can either do a blanket lift or utilize a stretcher made from poles and a blanket. A blanket is used as an improvised transport stretcher. Fireman's carry. Do not attempt if the victim has an injured arm, leg, ribs, neck, or back. You can also utilize a tied hands crawl or a pack strap carry. Arm carries. There are several kinds of arm carries that can be used in emergency situations to move a victim to safety. The one-person arm carry and the two-person arm carry. The one-person arm carry should not be used to carry a victim who is seriously injured, unless the victim is considerably smaller than you. You will not be able to carry the victim very far. The two-person carry. This is done unless absolutely necessary. It should not be used to carry a person who is seriously injured. The two animations below identify a two-person carry by arms and leg and a two-person arm carry. Insect and animal bite. Poisonous spider bites and scorpion stings are examples of insect bites. An example of an animal bite is that of a snake bite. Poisonous spider bites and scorpion sting. The signs of this are severe pain at the site of the bite or sting, muscle cramps, headache, fever, vomiting, breathing problems, seizure, or a lack of response. Poisonous spider bites. Make sure the scene is safe. Remove the stinger. Wash in running water with soap. Apply a bag of ice and water wrapped in a towel for 20 minutes to prevent bruising or swelling. Watch for at least 30 minutes for signs of a severe allergic reaction, that is, difficulty in breathing, swelling of the tongue and face, and signs of shock. Call 108 and shift him or her to a healthcare facility. Scorpion sting. Make sure the scene is safe. Get the first aid kit. Wear gloves. Call 108. Clean the bite with running water and soap. Apply a bag of ice and water wrapped in a towel for 20 minutes to prevent bruising or swelling. Snake bite symptoms: pain, swelling, nausea and vomiting, sweating and weakness, overwhelming fear, panic and emotional instability, diarrhea, vertigo and fainting, cold, clammy skin or severe altered sensorium. Snake bite management. Make sure the scene is safe. Get the first aid kit. Wear gloves. Call 108. Keep the person as still and calm as possible. Avoid moving the patient or the part of the body that was bitten. Remove tight clothing and jewelry. Gently wash the area with running water and soap. Position the site below the level of your heart and shift to a healthcare facility immediately. Don't use a tourniquet or apply ice. Don't cut the wound or attempt to remove the venom. Don't drink coffee or alcohol. Do not try to capture the snake, but try to remember the color and shape so you can describe it, which will help in your treatment. Cardiac arrest, CPR and AED use. What is a cardiac arrest? Cardiac arrest is an abrupt loss of heart function in a person who may or may not have been diagnosed with heart disease. The signs and symptoms of a cardiac arrest are sudden collapse, unresponsiveness, abnormal breathing, and bluish discoloration of the face. The first thing that you need to do is check for response. Shake the shoulders of the patient gently and ask him, "Are you okay?" If he responds, leave as you find him. Find out what is wrong and reassess regularly. Put the patient in a recovery position. This is a position used for unconsciousness and breathing casualties. It maintains an open airway so that the victim can breathe. This is an image of an individual in a recovery position. Let's start chest compressions. One, 2, 3, up till 30. There is a man down on the ground here in the indoor stadium. Continuing chest compressions, 1 to 30. Provide mouth-to-mouth respiration. I finally got the AED. The AED voice prompts are: attach the pads to the patient's bare chest. Plug in the pads connector. Analyzing heart rhythm. Do not touch the patient. Everybody stay clear. Do not touch the patient. Shock advised charging. Stay clear of the patient. Everybody please stay clear. Deliver shock now. Shock delivered. Begin CPR. Please start with compression again. Let's go at 1, 2, 3, 4. First, priority recognizing the emergency. Call 108. The next CPR emphasizes on chest compression. A depth of about 2 inches, at least 1/3 the depth of the chest, followed by the use of an AED. Shift the patient to an effective and an advanced care hospital. Good Samaritan laws. If you have questions about whether or not it's legal to provide someone first aid, you should know the National Good Samaritan laws. These laws protect anyone who provides first aid.
Dear audience, a warm greetings from Father Muller College of Nursing, Mangalore. I am Sister Judy SIC, Assistant Professor, Department of Medical Surgical Nursing, Fadamulla College of Nursing, Mangalore. Millions of people are at risk of acquiring mortality and morbidity due to inadequate or delayed assistance at the time of accidents. You can become a real hero at forefront of any accidents by saving the life of a person through the profound skill which you can have heard from this video on first aid. Thank you, Almighty God, the creator and sustainer of our life, for these few moments. We are indeed grateful to Reverend Sister Nida SIC, the Principal, Infant Jesus Center Schools at Trivandrum, for providing us this opportunity to organize a video-assisted awareness program on first aid. We do appreciate your initiative and passion to enlighten the mind of the students with such a medical practical knowledge. A deep sense of gratitude to Reverend Father Richard Aloysius Coelho, the Director, Fadamulla Charitable Institution, Reverend Sister Jacinta D'Souza, Principal, Fadamulla College of Nursing, Dr. Lulu Sharif, Head of Fadamulla Simulation and Skill Center, Professor Victoria D. Almeida, the HOD, and Faculty of Medical Surgical Nursing Department, and students of Fadamulla College of Nursing for their wholehearted support, studious work and commitment to dedicate this video to the community. Safety is the first aid to the uninjured, and first aid is safety to injured. Be safe, act fast, serve promptly, and save life. Thank you.